So Wendy, why don't you introduce yourself and then share with the viewers the services that you offer.
Okay. So I have been a physical therapist in the Doylestown area for 30 years, and I have had my practice for about 17 years. We see all kinds of physical therapy ailments, but primarily we specialize in vestibular rehab, which involves balance and vertigo treatment. We see a lot of Parkinson's disease, as well as orthopedic conditions such as total joints, low back pain, neck pain, and sports-related injuries. The other area that we treat a lot of is concussion, which is kind of overlaps all those areas because we use vestibular rehab and orthopedics in dealing with that.
Now, with all that you do here, what is your mission statement? What do you want patients to take home with them after they've visited your center?
Okay. Our goal is to provide an environment of healing and recovery for our patients, to use our PT skills and to allow them to return to their work, their life, their play, whatever it is their goal. So we use our specialty skills, whether it's manual skills, whether it's exercises that they can follow through and do at home, or maybe it's postural retraining so that they learn how to better do an activity to prevent further injury.
And if I have an injury and I need physical therapy, do I need to see a doctor first prior to making an appointment with a physical therapist?
So our physical therapists have what's called a direct access license. So we have a professional license, and then we have an additional license that allows us to see a patient for 30 days without seeing a doctor. At that time, after 30 days, then they have to follow up with the doctor. But generally, we have a good rapport with the local physicians. You can come to see us, and then we can follow up with your physician, send them a report of what the problem is, and the physicians support us in your care.
You stated your mission statement. You've also shared the services that you provide. What sets Wendy Webb Schoenewald Physical Therapy apart from other physical therapy centers?
So I've been practicing in this area a long time, and we see a lot of patients that come back to us. So that tells us, very importantly, that we're doing a good job. So I think that's one of the things that is important, is that we develop relationships with our patients, and they see us for one thing and come back for another, and that helps us to know a little bit more about them and to treat them better. Our therapists are very skilled in vestibular rehab. We all have done advanced training that I'm involved with teaching. We're involved with research in the field that helps us to stay on top of the literature and new things that are happening in the field to be able to most effectively treat those patients in the least number of visits. All of the team that I have here works really well together. A lot of us have different biases to our skills, but we help each other. So if somebody would benefit from a different type of massage that I don't excel at, I can work with another patient. And the same thing happens with our orthopedic patients or even our vestibular rehab patients. We work together to try to diagnose and give the most efficient and evidence-based treatment.